시청자 여러분 안녕하세요.
Ladies and gentlemen, greetings. This is Prosthodontics on Friday Live, which addresses different steps in implant treatment as well as its side effects. Prosthodontics on Friday has returned with the start of July. Today we have with us Dr. Sang-ho, a guru of screw-type zirconia implant prosthesis, to talk about screw-retained implant prosthodontic treatment. Greetings. I'm sure you're very busy providing treatment. Thank you for coming to Prosthodontics on Friday. Dr. Sang-ho, you're a guru. You're really renowned for your knowledge in screw-type zirconia prosthesis. I'm honored to have you. Can you briefly explain your lecture? Thank you for inviting me to this prestigious program. Today, I'm going to talk about what kind of prosthesis is most advantageous in digital era after looking at how implant and implanted prosthesis have developed. Listening to you speak, I feel even more intrigued by today's lecture. I look forward to thank you. To viewers watching the program, you can participate in the program via the chat screen, leave your questions, and get your answers. Through a lucky draw, you'll get Starbucks coffee coupons. Best question will be chosen, and the person who raised the best question will receive 3 coffee coupons. Study your implant prosthodontics and get your iced coffee coupons. Please note that you need to agree to marketing on dental site to be able to receive coffee coupons. I look forward to your interest and participation. Let us begin Dr. Sang-ho's lecture. Greetings. I'll now begin my lecture. Era of digital dentistry, now is the time to do screw-type implant prosthesis. This is the title of my presentation. The contents of the day: developments in implant body design, developments in implant prosthodontics, latest implant prosthodontic systems, ZSRP concept and traits, and HERI system cases. First, let's look at developments in implant design. The design in 1965, it was like this. External connection type was used. In 1974, tissue-level implant was introduced, and in 1985, Astra type implant was introduced. Implant designs have emerged every 10 years. You can see the changes. External type changed to internal, and bone level implant changes to tissue level, and then it changes back to bone level implant. Currently, these are the main designs that we have witnessed over the past decades. Let's look at how implant prosthesis have developed. How has it developed? At the time of the implant innovation, it was used primarily for dentures rather than for implant patients. It was used to support other prostheses like bar overdenture. Abutment for single tooth, conical abutment was introduced. Standard abutment and conical abutment. There's abutment screw that tightens implant, and the crown is tightened by 16 newtons on the abutment. 2 screw is used. In other words, it has a 3-story structure. When you look at the patients, if they have these prostheses, there's many to check. On the other hand, UCLA, it is tightened with one screw, so at periodic checkup, you just need to check this one screw. As shown in the UCLA case, if the design of prosthesis becomes more simple, it has more favorable long-term prognosis. This is a cement type that was introduced by Straumann, and CAD/CAM was introduced in dentistry. Custom abutment was introduced since. Zirconia became more common in dentistry, and people came to think that everything may be possible with the use of zirconia, and zirconia abutment was introduced. If you look at recent study, when you use zirconia abutment, zirconia can cause wear on internal surface of implant body and can damage the implant. The result of this study was that it is not ideal for zirconia to be in direct contact with implant, and it is suggested to change this part with titanium. This is the link design. In upper anterior, cement abutment. Within it, there is this component that prevents direct contact between implant and zirconia. For posterior area, these are the links for zirconia screw-retained prosthesis. If you use these short links with bevel in the posterior area with the crown, this may fracture. Therefore, hairy abutment or hybrid abutment or tie-base abutment. Different types of screw-retained prosthesis were introduced. There are cementless system among screw-retained systems. DHL system. This was introduced a couple of years ago, but it does not have a lot of clinical background. If such crown design goes in the posterior area, considering how tough the food people consume in Korea, I believe it will fracture. With the elasticity of the slit, this design does not use cement, but there are risks associated with fracture. Therefore, not a lot of people use it recently. Highness system is also a cementless system. It's a solid type. The screw is fixated, and on top of it, another screw is fixed. This is a 3-story structure. Therefore, there are 2 components. It may be quite expensive in terms of cost. These are cementless types. As a prosthodontist, I don't believe cement itself is bad. Excess cement that remains in the gingiva, that's problematic. Cement within a gold crown with good fit, even if 10 years or 20 years pass, it's not going to be a problem. The problem is excess cement. The cementless system opts out cement, and in the dead space, there can be potential of anaerobic bacterial growth. Easy crown also has 3-story structure. Abutment is tightened and crown goes up on that. It has a complicated structure. The crown is retained using the elasticity of a ball, but this structure is unfavorable long-term, in my opinion. This is a new system. With friction, the crown is retained. This is also a 3-story structure, Django abutment. There's no clinical experience using this abutment. This system is cementless. I believe there may be potential issues with micro gap. Uncontrolled cement is bad cement. In the case of Harry's system, it is a ZSRP, zirconia screw retained type. Abutment and crown is bonded. It's a type of gold UCLA. The white gold is changed to titanium and the gold is changed to zirconia. It is a modern type of UCLA. Let's look at implant prosthesis briefly. The most notable screw type is gold UCLA, and there's cement PFM. As CRP and most recently introduced ZSRP, which is a zirconia screw retained prosthesis. A lot of people use cement retained implant prosthesis. What are the advantages? First, you don't need to use gold, so it's good in terms of cost, and even if implant is not placed accurately, you can compensate for that using crown, and lab process is simple. When a solid abutment was first introduced by Straumann, it was very intuitive. You place implant in gingival level and you tighten solid abutment and you would put in cord and take impression like natural tooth. Using cement is easy, but there are disadvantages as well. The benefit or advantage of cement type is it's easy and cheap, but when problems rise, it is impossible to remove it, or it could fall off even in cases where it shouldn't. There could also be issues related to excess cement and also peri-implantitis. In treating implantitis, if you can remove the crown, treatments can be made more easily. But in the case of cement type, it's difficult to separate crown. The opposite type of cement type is gold UCLA. It is expensive, accurate surgery is necessary, and you need to pay a lot of attention in taking impression. But once it's completed, unlike cement type, you can untighten it and remove it. You can also respond to contact loosening. In treating implantitis, you can separate it and make necessary treatment. Cement type is good for the surgeon in many ways, whereas gold UCLA is beneficial for the patient in many ways. SCRP was introduced to remove excess cement problem with cement type. You use the same abutment as cement type. This removes excess cement, but you need to do more work because you need to do cement type related effort, and then you need to untighten it, polish it, and do the process related to screw type. Also, if the VD is narrow, the SCRP can also fail, same as the cement type. Both types have the same problem. The advantage of ZSRP is utilizing digital dentistry. It has the benefit of zirconia added to the screw type. Zirconia, gold, lithium disilicate can be used, but zirconia has many advantages. Therefore, a lot of cases, zirconia is used for crown. Can I ask you a question? I believe ZSRP, zirconia screw retained prosthesis, has many advantages. It seems like a good system. One concern is compared with existing systems, will it be more costly? Next, I'm sure you have a lot of experience with it. After you tighten the screw, will there be issues related to screw loosening? Screw loosening can be a big problem. I'm concerned about that. Thank you for your question. Regarding screw loosening, I believe accurate prosthodontic planning is very important. For example, the conical abutment in the Ronemark implant system was tightened to 25 Newton. The gold crown was tightened with 16 newtons of torque. By 16 newtons, it's about the amount of force that is applied when you use your fingers. I've seen many cases where with even that, if the implant has been placed in the right direction and has the right contact and occlusion, the implant didn't loosen. It's not a matter of torque, but about correct treatment plan. Through loosening an internal type, rather than a problem with prosthesis, I think it has more to do with occlusal force. Even if you tighten by 35 Newton centimeter due to sinking, caused by chewing on tougher food, this can cause problems to the implant and it feels as if screw is loosened even though it isn't. I've talked about 3 different implant types. I think that is disadvantage of internal connection. You need to understand the pros and cons of different systems and do periodic checkup to address them early on. Thank you for your answer. There are many comments on the chat screen. Let's take a look. Godzilla, I've come to see the live program. Thank you. Good doctor, Professor Joino, Dr. Amsango, greetings. ID Dororo, prosthodontics on Friday, good luck. Many people have left comments of support. CMIM6, implant longevity, it's rather short. Is there a good product? I think Osstem is #1 implant company. Thank you. Thank you for the wonderful answer. I use Osstem a lot. ID, I love you. There's a question. I've heard a lot about Harry system, and I've looked at a lot of images, but I have no experience. I don't know how it is set actually. It's still unclear. Is there a micro leakage in space without cement? I believe this will be addressed by the doctor as he talks about the system and shares his clinical cases. How to set the prosthesis and the fact that it's cementless, it's going to be discussed. I look forward to Harry's system. TS raised this comment. If a patient who has received implant treatment, if the patient complains of inflammation or pain, what do you do? CMIM6. I believe this is due to multiple causes. Today, the topic is about using system without using cement. I believe using that could be a solution. Regarding your question, sometimes there are vague situations. If there's inflammation and the patient is complaining pain, you know what is causing it. The approach is clear. You can remove inflammation. In my case, I use a screw type. I detach the crown and use diamond burr to do polishing, or I extract it and place it again. If the surgery has been done nicely and ISQ value is good, and if occlusion is good, yet sometimes the patient says he or she feels weird. In cement type, this is not possible, but screw type, you can disintegrate it. I've measured the ISQ value once again. At times, patient is right. Originally, it may have been 80, but within 1 or 2 weeks, the numbers may drop. In that case, due to unknown causes or biological reason, problem has occurred with the implant and the patient noticed it first. In this case, I have the patient wear the healing abutment for about a month, and after that, I check the numbers once again and respond to it. In other cases, if I measure ISQ, the value is even better. It means it's very good. If the patient is complaining of pain, you can explain that ISQ value has improved and that implant treatment has been done successfully. You can say with conviction that the implant is without problem. And this is possible with screw type. Hot summer. I think there are similar systems. What is the advantage of hairy system compared with other system? I believe this will be addressed during your lecture. Then we'll stop here and resume with your lecture. Please carry on with your lecture. ZSRP, which is a type of cementless prosthesis, it's actually not without cement, but it does not have excess cement. I'm sure you're all aware of SCRP. You do cementation on the abutment, and after that, polishing is done after it is disconnected. The SCRP process ends in the lab. The advantages it has: it reduces the dentist's chair time. Let's look at the principles and characteristics of zirconia screw-retained prosthesis. In looking at review, I wanted to see if there was something that made the screw-type prosthesis using cement. In 2006, this was reported. On stuck abutment, tested prosthesis was cemented. On the model, screw-type was formed. In ZSRP, as mentioned before, screw type has many clinical advantages, and zirconia has also many benefits as well. Zirconia screw-retained prosthesis is a combination of zirconia and screw type, and hairy system is one of ZSRP. As mentioned, SCRP, the abutment comes from cemented type. Therefore, it also shares disadvantages. Because the superstructure is tapered,